Amore Pete's King, serving Rockville since 1972. Dine in, carry out, or drive up window. Come and see us. Thank you, Rockville, for 50 years of business.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, thank you all for coming. It doesn't look like we have too huge of an agenda today, so we'll move right along best we can. First, we have the minutes from July 18th meeting.
If you guys have time to look at them, I make a motion we approve the minutes for July 18th.
I'll second that.
Do a second to approve the minutes as presented. All in favor say aye.
Aye.
Okay. And we have payroll. In the amount of $184,289.16.
Plus an additional.
Yeah, we'll get that. We'll do them separately. Yeah.
Okay.
Yeah, I make a motion we approve payroll in the amount of $184,289.16.
I'll second that.
All in favor say aye.
Aye.
Okay. Then we have, it's a rare occasion, but we have an additional payroll to approve. 4 workers with the emergency management were missed with their overtime, and so to get that to them as quickly as possible, the most expedient way is to just do another payroll. And the amounts of that payroll, we have $8,257.28.
Now, mine's
Pretty
showing
faint.
$8,334.
Well, that's on the front, then we got one on the back.
$8,334.20 is payroll.
Okay. Well, that's claims in the back then, okay. All right, is there a motion to approve?
Yeah, I make a motion to approve the payroll in the amount of $8,334.20.
And I second that.
All in favor say aye.
Aye.
Is that really faint or am I going blind?
That's a bit faint,
Okay.
but you're getting old.
I am getting old. Maybe it's time for me to
You're a bit blind also.
get back in my cave. Well, I'm ugly too, but I still get to go out once in a while. All right. Then we took care of the bank error. And I would like to make a note for the minutes, if you could, please. On that error of those missed 4 individuals, that was a bank error. That was not an auditor's office error. That was the bank. The bank acknowledged that. We were not the only business affected by that. And so this was the best fix for us to take care of. All right, then we have claims amount of $1,466,251.74. I'm guessing it is highway stuff.
Yeah.
Did you skip the claims for, is it the 57,654.07?
Oh, yeah, I just didn't even see
That
that.
needs to be corrected to $77,631.58.
Say that one more time, 77?
$77,631.58.
Okay.
Plus the ambulance center was $2,175.83.
There's 2 of them, just like there was
Yes.
payroll.
Okay. So we have 2 claims to approve like we did with the payroll. One for $77,631.58, and then one for $2,175.83.
Okay, I make a motion, we acknowledge and receive the payroll claims in the amount of $77,631.58.
I'll second that.
All in favor say aye.
Aye. And I make another motion, we acknowledge and receive the payroll claims in the amount of $2,175.83.
I'll second
All in favor say aye.
Aye.
All right.
Now we're ready for claims.
Now claims the amount of $1,466,251.74.
It's a big one.
Yeah, I'm sure it's highway department
Yeah.
paid for time. I'd like to make note that our highway department is doing a good job. I've been watching and driving it on Video Road from Bloomingdale to Strawberry Road, and then golf course road, which runs from BDO Road out to 41. They're should be finishing on the southern part of BDO Road today.
And that being said, I make a motion, we approve the claims in the amount of $1,466,251.74.
I'll second that.
All in favor, say aye.
Aye.
Okay. All right, now we have some new business here. First, we have a hand-typed check for $803 to Indiana.gov, and that would be for the, what do you call those?
Credit card swipes.
Swipes, credit card swipe stations for the courthouse to operate with the new website. So I'd make the motion that we approve that $803 to IN.gov.
I'll second that.
All in favor, say aye.
Aye.
Okay. Today's the first, right?
Yep.
He is the first. Got a bunch there, Dane. You got them all organized?
If I don't, sure we'll finish getting them.
We'll wait on this one, this next one.
Is that it?
All right, next up,
That's all I got.
next up we have a contract with Dossett Consulting, LLC.
Did we,
Who is this, what is this
did
for?
we make the motion on the hand type? I'm sorry. Did we make a motion on the hand type? We did? Okay.
Yeah, Jim made it while we were signing, I seconded it. We
It
voted.
looked like it was for auditing for monies received from the state and federal government. It's a contract for them to do some type of auditing. They assist in getting reimbursement. Is how I read it.
Well, yeah, what Jeff does is, he does a cost report. Laura, you may be able to explain it better than I do, because he does it both for the clerk's office and for the auditor's office.
And the prosecutors.
And the prosecutor's office. Because part of the Title 4D program is indirect costs from the federal government. And so what Jeff does, we've had him for years and years and years and years. He used to be a clerk and a county auditor, both up in Montgomery County.
Okay.
He just comes in and does
Yeah.
an audit of the disbursements and stuff, and then he helps
Tracking it.
helps us to get our cost reimbursement then from the federal
Okay.
government.
There's
So,
two options listed in there. You guys have to choose between. One was 3,000, one was 9,000.
remember what we've done in the past.
Okay. One is for a 3-year, so it locks in that $3,000 a year for 3 years, but it's still payable, $3,000 per year.
You remember, Laura, did we go 3 years in the past, or did we just go year by year? I don't remember.
We went, this is the same contract usually every year.
Yeah.
I didn't check the costs.
Did we take the 3-year option or the 1-year option? Do you remember?
It's the same cost per year, but we can either initially do it 1 year, or, I mean, we're gonna, if you say we do it every year, we're gonna do it every year. It makes sense, I suppose, to lock it in rather than worry about an increase
Yeah,
for the next couple of
the
years.
whole thing, if the costs go up, you can lock it in,
Yeah.
but I don't know how much more it can go up.
I'll leave that to you, whichever you
I don't remember
prefer.
exactly, I think last year was just a 1 year, because we did it, we approved it every year.
I don't remember doing a 3-year. I would say just do 1
Okay.
year.
That's your motion then?
Yes, I make a motion, we approve Dawson to consulting's contract for cost analysis for 1 year, $3,000.
Second that.
Move to second to approve Dawson Consulting a contract for 1 year at a cost of $3,000. All in favor say aye.
Aye.
Opposed? Okay.
Okay, I need a signature.
Okay.
The second one is just yours, Jim.
Okay.
It's initial.
And we're just going to initial the 1 year.
Back when
I can find it.
the other way.
Okay.
There it is.
Gotcha. 1 year, 3,000. Okay. All right. And the other one, just notification of our reimbursement from Indiana Department of Corrections. We'll get a reimbursement amount of $10,793.83. That will be deposited to the county, and also we will be getting from the felony level 6 reimbursement amount of $116,563.28. No action we can take on that, it's just for our acknowledgement. All right. Then we have the RX insurance contract. We've already talked about this and approved this. Nick was waiting for a correction on the original for us to sign. You're satisfied that it's okay then?
Yeah, the language we were looking at is on page 2 under 4.2, and we kind of talked about that before. It's got 2 different payments. It's got one for reimbursement on the 2nd, 17th, and then it's got another one that's a different payment as far as their part of whatever the cost savings was.
Okay.
So there's 2 reimbursements for actual costs incurred, and then there's their fee out of the savings that
Okay.
they get. So the wording makes more sense.
Okay. So you're okay with us going and signing it? And we've
Yeah.
already approved it, so we don't need to approve it again.
It's a 1-year agreement and a 30-day opt-out. So
Okay.
if we're not happy, we can opt out of
Give me
it.
that, well, and I'll sign it. I think it's just me. Nope. Is it all?
Looks like they just had one.
Yeah.
It's just
Just
one.
me, yeah.
It's like, yeah.
And then they had a list of the medications covered on there too. So
And that formulary can change kind of based on how our usage of our plan.
page 10.
We got it. All right.
And then you be sending something out, Lord, all employees?
Tomorrow after,
Okay.
After this
Explain
gets
how
signed
how
today.
how they do it and how
Yeah.
they.
because I gotta take this and I have to scan it to them
Okay,
tomorrow
no, that's
morning.
fine, but
And
I'm
then
just-
they're going to send me a pamphlet thing, and then I'll print that out tomorrow and send it out to all the
so
employees.
that way the employees know how
Yep.
to use it.
Yeah, so I've got a couple that's, their children are diabetic and they're really interested in this.
Are they going to scan you back their signature? Then we don't have one with their signature.
Yeah, they should, they normally do.
Okay. All right.
Okay, the only other new
Wait a
business.
minute, on this one here, I need one more signature. for you.
No, didn't see it.
Okay, on that page, I need another signature. Does that look right? So right, Nick, there's 2 pages, or two different
Yeah.
signatures.
Flipping through. And there was at least one page 8.
Page 15 is
Way
also.
back in the 35 or something.
Yeah, 2 spots, 8 and 15.
Okay.
Thank you.
All right, the only other new business I have, Don and I met, as we do every year, talk about our needs as going forward on equipment and his maintenance equipment. The only thing that's out there that's a concern right now is the mower. Right now we have a mower, it's John Deere, that we use for both mowing and for winter maintenance. It's got a cab on it. It's got a blade and a blower for snow. There is a time period in the spring when we take that off and put the mower on. And sometimes not often, but sometimes we get caught in the middle where we got the mower, not the mower stuff. Oh, we got the mower stuff on, but then we get a snow and we can't handle the snow. So that's not a reason for this at all. But what we're looking at is that piece of equipment is 14 years old. To replace that 14-year-old piece of equipment with the cab and the blower and the blade and the mower deck would be about $20,000. We think that if we were to delegate that mower to just winter operation only, leave everything on it, maintain it for that, some winters it'll get used, some years it doesn't, and then purchase a mower to do the mowing with, we think we get several years yet out of that John Deere unit. So we shopped and looked at the Spartan dealership, TLC, there on 41 north of town, local dealer, and we can get a Spartan 54-inch for $5,600. Don does have that in his budget, and it made sense to me that we go that route and try to preserve and not buy a $20,000 thing looking at us down the road, but to keep that for winter use and then get a mower to do the mowing with. So
Is that your motion?
if no questions, that'd be my motion that we go ahead and purchase from a TLC lawnmower. It's a Spartan mower RZ-C 54-inch for $5,600.
Okay, I'll second the motion. Don has the money to buy the Spartan RC-C 54-inch for $5,600 from TLC.
Okay, moving to second to go ahead with the purchase and let Don know. All in favor say aye.
Aye.
Opposed? Okay, I'll let you know. Laura might want that. That's what we'll be getting. All right, you guys have any new business? All right, old business. We just have the insurance contract that we just signed with the RX. I don't have any other old business. Anybody have anything?
Nope.
All right, then we'll go to departmentals. Hamilton Center have anything? No? Before we go to, what's her name?
Yeah, what's her name back there? You
One
can
I
see
have.
that she's ready.
Do you have anything for us?
I have just 2 quick things for you. Regarding website, we added a change today just through conversation. Julie had actually said she'd really like to get her employment application online so that she didn't have to keep emailing it out. So we created an area called Career Opportunities for Parke County. So as your departments have openings that they want to post, if they're a different kind of application, that they can do that, and we can use that as a place to refer people, if they're interested in positions, to look for that.
I think that's great. Good thing to do. Good
So
idea.
that got put on today.
Are we live today?
No, so we originally said the 16th just because we were trying to clean up some test access areas, but a lot of that got completed through today. So I'll talk with Clarissa and see if maybe we could go live on the 9th instead of the 16th, which is what we had targeted was the 16th.
Great.
So that should be the latest.
Great. I'm excited to see how it goes. There'll be things, of course, but that's what we're there for. That's what the soft opening is for, so we'll just see how that goes.
Yeah, so Randy, I think on most workstations has the credit card swipe devices installed. There was some confusion because we thought we were still in the test environment, people were using it, and it was actual live charges.
Oh, that's funny.
But we've corrected that,
That's funny.
and so anyway, so then they were like, okay, give me the old one back for now, and I know the health department said they're starting to get things in for Cover Bridge, so they're anxious for us to get switched over.
Great.
So that's where we are on the website, and one other thing I wanted to mention was, since I am designated as the Parke County's point of contact for broadband, the state broadband office sent down some information today to help disseminate about programs that are out there to help folks get signed up. So one program I wanted to mention, because I hadn't really dived into it that much before, is an affordability connectivity program. And when I first read through the eligible requirements to get help there, which is where they provide $30 a month towards your internet bill. Originally, you know, I kind of stopped at you had to be at 200% poverty level to be eligible. But then as you read through it, if you are on programs such as SNAP, Medicaid, any kind of public housing, if you are, anyone in your household receives benefits for the free and reduced lunch programs or free breakfast programs, you're automatically eligible for that discount.
No Medicare though, I guess, huh? Medicare's not included then.
No, that is not included. There are some other pieces to that, but those are the things that kind of rang true to me for Parke County with a lot of the, we hear a lot of the staff from the schools about free reduced lunches. So I'm going to try to help get that out as much as possible for folks to know that it's there and start passing this out. So just if you hear folks needing that assistance, they'll have to go online. So if they need to go to the library, or we could open, you know, a computer here for them or something, so they can go on and register for that.
Great. I know I told you before, and I don't want to carry on, but I really appreciate all the work you put in on making this change over on the website stuff. Not just this stuff you're talking about now, but the website stuff too. It's going to be refreshingly new and up to date for us. It's going to be great. So I appreciate that.
Yeah. And we did that career opportunities on the home page, so it's like you've got a nice picture at the top, and then down below you'll see that career opportunities. So.
Okay, thanks, ma'am. Next, we have Stephanie Law. Stephanie, if you remember, we appointed to the health board here some time ago, where she was willing to serve. Again, I don't want to carry on about her, but Stephanie is you can come up to the table, it's fine. Sit right there at the end. Yeah.
Sit at the end.
Yeah, that way they can see you on the camera, we can record every word that you say to us or about us. We have it all, we approve of all of it. She has done so many things for Parke County through a relationship, especially during the COVID times, between Union Hospital and Parke County. Many of the programs that we have and the opportunities that we've taken advantage of would not have happened without her. I really think we would be in a case where we would not have a county nurse full-time without her. That was a program that she came up with, where the county nurse is an employee of Union. We leased that position from Union, and all the benefits and everything else is through them. And I just deeply appreciate the effort that you put in now. Now she is president of the health board, and I have asked her before to look at these things, and she has taken far beyond what I asked. I mean, she has just picked up that ball and gone. We need, because health boards are really under scrutiny now statewide since COVID times, we need to make sure that the people on that board are showing up for meetings, that they have quorum so they can do business. We have to make sure everything is protected and identified, internally controlled all the way through. So mine too.
Because we're a county emergency.
So, so I appreciate what you've done. So I asked her to come present today. She has a couple things. We're talking about some software needs and server needs, and we're also, which we've already talked about some time ago when Randy was here, but Randy and Chris and I met about that, in fact, one time. Yeah. But she also has some updates for us on those who are on the board or looking to be on the board and their eligibility. One last thing I'll say before we go, and she brings this up, just so everybody understands, the health board in a county is still one of those boards that is susceptible and responsible to being no more than a simple majority between Republicans and Democrats. So before, and we went through this some time ago in the last appointee, before we can make an appointment, we have to discern whether they are registered as a Republican or a Democrat, because you can't have more than one more member of the board being from one party or the other. The way that is determined, as silly as it is, but I have to have some way to determine it. What determines if you are a Republican or Democrat is which way you declared in the last primary you voted in. So the last primary you voted in, you would have had to pick up a Republican ballot or a Democratic ballot, because there's no other choices. And so if you voted in the last primary, whichever ballot you chose to participate in, that would be your registration designation. So I'll shut up and you go right ahead and tell us what you got.
Well, thank you so much for those kind words, and it's my pleasure to serve the county. And as Jim said, look into the matters of the health board and see how we can better collaborate across the multiple entities and just jurisdictional issues, because we do rely upon each other for a lot. And so one of the first items of business is to look at our compliance with the state statute, the Indiana Code, as Jim indicated, for the balance of our health board, as well as the compliance it outlines in the meeting attendance. And so what we found is that we had been out of bounds for compliance for some time, and so had ran those attendance records, and then I drafted a letter that got to Nick Sauter, and he approved that. And so we will be issuing those to those that are affected of, hey, if you want to attend, let's do that because you're out of compliance, and they have until August 26th to contact me. Or otherwise they will be, by the state code, off of the health board. I anticipate that since we have already drafted the letter, word got out, we did receive one resignation, and then we had a vacancy that we had already in place, and then we anticipate one more. So what we will be coming back to in future meetings will be 2 Democrats and 1 Republican for your consideration. And so today I spent time with Janet going through voting records of exactly what Jim indicated, of those 22 primary ballots that were pulled in the primary. But then we also looked at all registered Democrat voters and those that did not even vote in the 22 primary. And there was a lot of no showing out for the primary election, I'm sure, as you could anticipate. But we got a list together today. And so what you can expect is that we will come back with a list of recommendations with that mix. But there will also be another group on that list of those that we identified through our records research that you could consider from. And I would also highly encourage you that if you know somebody who meets the criteria, which it is spelled out in the state code, can get that to you, because we have to have this mix of some health professionals, social work, mental health. I mean, there's certain criteria that you have to exist to be on the board. And then there's also 2 general seats, so maybe you didn't have any healthcare related knowledge, can be considered for the board. So just know that if you have any interest, or anybody that you know of that would be interested in serving, we're more than happy to look at that. And if we can get them to fit with our balance of our board, we are more than happy to take them into consideration.
Only question I have on that is, and maybe you would know from finding the statutes, or maybe Nick knows, how many primaries have had to intercede for you not to be either to be an independent? How many primaries have had to have passed where you did not pull a ballot one way or the other?
I don't think the statute actually indicates that.
Okay.
It just indicates the last primary.
So is there such a thing as an independent, that it wouldn't be an R or D either one and affect that balance?
No, because you're
It
registered.
would be the 2.
But if they've never voted in a primary, how do we determine what that person is?
That's a very good question. I'd have to look that up
Okay.
and research it.
My question is, I guess, could we assume that they are whatever we want them to be, since they haven't committed any other way?
I guess off the cuff, if I had to comment, it'd probably be whatever they identify themselves as.
Okay.
But
Okay.
I would need to look at that.
Because we had one kind of like that, who was considered probably a weak
That
Democrat.
was considered a weak.
Lead more Democrat than
Haven't
Republican.
voted in the primary in some time, and
Right.
so and
There's always gray areas. I'm just curious if that was lined out in place, how that.
not in
Yeah.
the statute,
Okay.
no. But I'm sure there's probably some type of case law on that somewhere that indicates.
So if you have someone, I guess what I'm asking, if we recommend someone, or we recommend someone that has not participated in primaries as far back as you go to look, 5 years, 10 years, elections, whatever, would we be safe to appoint them? That would not affect that balance?
Well, I guess it'd be
RD?
similar to a new person that had just become voting age that had
Right, that's
registered.
what I'm
And it'd
thinking.
be the same type of situation as that.
So for now, we could appoint them until such time as they
But
make a
I
determination?
think what happened last time, though, we had a list.
we had one that
People
we
that
didn't
apply.
know what they were.
Right.
We
Right.
had several that were Republican, and we had to appoint a Democrat, and
So now,
We
when
could-
we present our list, you will have the party affiliation, you will have the names, and it will all coincide with the state code.
Okay.
So to Jim's point, I don't know about the independent because all of the voting records that I reviewed with Janet and Liddy today were registered Democrats.
Okay.
Now, in the 22 election, even though they were registered Democrats, there are quite a few that pulled Republican tickets because they were interested, I'm assuming, in the sheriff race.
Absolutely, happens a lot.
Or another race.
Yep.
And so we had registered Democrats that pulled Republican ballots, but then we also had registered Democrats who did not participate in the primary election. So we kind of have like this group of three.
And if you're registered as one, I just know this from experience, if you're registered as one, but you pull the other ballot for that case, you are what that ballot was you pulled. I don't care
That's
what you're
exactly
registered
right.
as.
So I have
It's a franchise
exclusions
yourself.
of registered Democrats. I have to exclude those that
Okay.
were registered Democrats who pulled a Republican ballot in the primary election.
Okay.
Those are excluded.
Okay.
Excluded.
Okay.
They're Republicans now for this
Mhm.
purpose.
Yeah.
Yeah, for this purpose, even though they're on
Right.
registered Democrats. So, with that being said, we will be bringing back a list.
Great.
I would anticipate to look for that list because in order to do business as the health board, I have to have a quorum and I have to have people show up. So I would anticipate reasonably that list will come back maybe to your second meeting in September because I would like to get the other two board members that I have that participate
Great.
to weigh in on some of that.
And when is your meetings?
They are usually quarterly, but what I'm going to do and what I have asked for is to set these meetings kind of like your commissioners' meetings so that they are known, that they are publicly advertised, and
Right.
that we can have anybody who's interested in attending either from the council or from the commissioners be present at those meetings. And I would really like that engagement.
Typically, and I say this to everybody, I mean, anybody can show up to our meeting at any time, and we will get them on the agenda to speak. In your case, with the decision we have to make affecting your board, even though it's not required, you can still come to the meeting. If you're not on the agenda, we get it there. But the purpose of the agenda is to let the public know what we're going to be talking about,
Right.
discussing, and the health board is so significant. I would appreciate if you would make an effort to get on the agenda, so when the agenda is published about the next meeting, people who care about that issue would know that's going to be coming up. On the meeting.
Absolutely, absolutely.
Really, the health board's been kind of, even though they've done a good job, I'm not saying that at all, but it's kind of been that lost section of government where they just have done their own thing in their own corner for so many years. Nobody really knows what goes on, but we found out during this COVID time, it is important what they do, and they do important stuff. And so if they care about who is or is not on that board, it'd be good to let them know ahead of time who's being considered. So if you could do that, that'd be great.
So my first item of business, obviously, is to pull the health board and the department into compliance with the state code. So first and foremost is we have to make sure that we're proceeding legally. Secondly, just as an informational update, we have been working with Julie Lanzone from Parke County EMS. Due to the fire, they were not able to continue their vaccination efforts, and so a refrigerator and a freezer had been acquired to do vaccinations for children, as well as the COVID-19 vaccines and the boosters and such. And so I spoke with Julie 2 weeks ago to ask her, now that we have stabilized the nursing component of the health department, how can we collaborate or how can we help, especially given all of the moving pieces with the ambulance service, to sustain this piece for the county. And so the recommendation was to move the vaccines over back to the health department, and that she would help us with that transition. We did have a meeting on Friday. And so there's a state website that is a registration called CHIRP that her folks are registered through. We're going to keep them that way and then have the health department side. So if we do have like a mass vaccination clinic or something like that, we can call up on our friends at the ambulance service that have those license and certifications that can give injections and have that skill. So that way we're more collaborative than we are isolating. So in order to do that, we had to identify a physical space within the courthouse to be able to house the refrigerator and the freezer. And there are certain mandatory requirements because we will have to have an inspection on the site.
And it's a regular freezer, it's not that deep freezer
Right.
that was the COVID.
I think total is like 9 cubic square feet and such. and then where to give the vaccines and where to, because I was in the health department today and people just walk in randomly, and that's good because it is a public service and it's an opportunity for a county to just walk in. But we identified a space there in the basement that Jim walked through, and I think that Don,
The old card room.
the old euchre room. And so there is a lot of storage that was in that room, ranging from the multiple pieces of protective equipment that had been sent to us from the state, just stacks of things. And so I brought a crew today of my team from the hospital, and we volunteered to go through and inventory all of those pieces to find out what the county does have. So that inventory has now been completed, and then we will be moving those items out for storage.
And that was the idea of the inventory, that they can store it at their place. We know what we have access to them at any time, and so it's
And
just
you can
stored at another
redeploy it.
location. Yep.
But the items largely consist of masks, gowns, gloves, and swabs and some syringes, but we're leaving the syringes on site. But that's largely what consists of the PPE in that room. So we were able to dispose of a lot of expired equipment pieces today, a lot of boxes of just things that really are not worthy to stay out in an environment, and especially in the courthouse where it's not as controlled. So we were able to evacuate some of the expired pieces today, but we anticipate having that room cleared sometime next week, now that the inventory is done.
The benefit of that room, Don and I talked about that, is not only it's got the door you can close, you can do anything we want with the curtains and the windows, but one of the requirements of the freezer is to have a generator to protect it. And by being where that is, we can put a generator inside the enclosure where the dumpsters are now, and Don can run a direct dedicated line to a breaker there and feed it directly off that site. It's close, no big wiring required.
And what I would like to explore as part of this endeavor, since we have to have a generator for this particular refrigerator unit, is that we need to think about collaboratively with the health department funds, and all of this come out of the COVID relief package of how do we purchase a generator that serves the entire courthouse in addition to the refrigerator freezer. I think that we need to look in a macro sense instead of just microscopically at this refrigerator freezer. And so I'll be getting with Chris O'Brien to see, what are the costs for both options. And maybe we need to make option A, but it would be really nice if we had a redundancy plan for the courthouse in general that served a bigger purpose than just the refrigerator freezer.
Short term though, we're good to go. We get the small generator, get it up and going, and then look farther down the line with the other stuff.
Yep.
We've talked about the courthouse generator before, take a big one of course, and so that's what we're trying to determine how we're going to do that.
Yep.
And you can also, if you break that out circuit-wise, you can dedicate it to the computers, that kind of thing. You don't have to run everything off of it. So yeah, we have a lot of options to look at.
And so that's what's going on. So I wanted to make sure that informational piece is there, and as additional dates and timelines come available, we will certainly share that with you. And then from the nursing perspective, as he had stated, it is a union health employee. That contract ran through, the Department of Nursing, and we have stabilized that quite a deal. That we have overcome a lot of the shortage, not having a nurse for multiple months. But she is really engaged providing more services for the community that's outside of the COVID lane.
That's great.
We have so many disparities in Parke County, ranging from high blood pressure, smoking cessation issues. We have some of the worst health outcomes in the state comparatively. And so she is very engaged to be able to provide additional services that are meaningful to the community in which we serve. And so some of the concepts, and we'll come back with a roadmap so that you could really understand and digest that, but we want to work with all of our volunteer fire department agencies where we have vaccination, we have blood pressure checks, we have other things where folks can come out to that help us understand what kind of services the health department can provide the community.
It'd be nice to have a real service entity there, and that's what it will be. Yep.
So the real ask that I'm coming for today is that we have vetted as the health board, it was like one of my second meetings that I attended, for a software program that allows us to digitize our birth records and our death records, as well as create an electronic version of our sanitation inspection. So when there is a septic tank or even a food permit, we can make sure that we have a way to have a legacy to log all of those pieces.
And with your birth and death certificates, you'll be able to print them and
Print them
visit
on
those
site at time.
Immediately, yes.
Mhm. And so just quickly, and I can pass this around, but the yellow Indiana counties on this map are the counties who have purchased this one-time purchase of the software. And with the Real ID coming with the DMV and having to get these birth certificates and these other records in a timely fashion, we are finding that from the state platform there are some inaccuracies that have been found, as well as a lag of 2 to 3 weeks time upon those requests. This would put us front center, click, print, ready of these documents to be able to provide to our community in an effort to get them the information they need, whether that be for a death claim or whether that be for their Real ID.
And if you've gone through the death of someone in the family, having that 2 or 3 week or 4 week wait to get that death certificate in order to file an insurance claim to pay the bills of the funeral, that's really cumbersome. This is great that we'd be able to walk in the door and walk out with that.
So there was no purchase agreement to vet through Nick. It was just a one-time, here's your invoice, and so it would be like the issuance of a PO, I guess, or something like that. But there was no issuance of any kind of a plan or service agreement. There's no ongoing charges. It's a one-time fee. Talked to the individuals at Putnam County and got their feedback. Vermilion County as well. And so you can see that we're kind of an island that's not with this technology providing it for our citizens. Talked to, I hope I don't butcher it, Randy.
Randy Cleaver. Yes.
Randy, the
No question.
IT person.
In fact, we talked about this before, if you recall, about if we had room on the server to put it, because they were talking about getting a different server at one time, but Randy's assured that we have space. And
We do, and one of the issues coming from healthcare is that do we have the cyber protection for vital records that's housed on our server? I did get written correspondence via Liddy from Randy, a Word document that says that he sees no issue with us going forward with this. Now, the issue may come in the future tense that, we have enough space. But there may be a future tense where we need to explore having our own server, or maybe we collaborate like a generator and get a larger server to house for the courthouse where we have this piece parsed out. But this would be a simple build, install for the county, and we could start as soon as possible, as soon as we get the money appropriated for it. There is money within the health department fund for us to go ahead and do it, so it's not going to come out of any other budget line. So we do have it.
What we talked about when we met was that they had the money in their budget to cover that, and there's no contract ongoing as far as service or anything else. So it was a gray area. Nick would know better than I if there was really any need for us to approve it. But what I like is that relationship where whether we need to be aware of it or approve it, I think we should always agree on those things so we all know what's going on. We know where the money's going. Because that's always been a question with the health department is where is their money going? Mm-hmm. The internal controls weren't there. The sharing of information wasn't there. Mm-hmm. And I'm excited about having that change. And so I don't know that we need to approve the purchase, but I think we should approve it, at least to show our support for what you're doing.
Yeah, and we did, I know she's gone, but we did make sure that there was no duplicative efforts with the county website to make sure that we weren't recreating another silo of information. But this is simply, we hope to get everything digitized, even our paper records. I've got a few volunteers that will help us get those entered. So that's the goal, is to get everything
let us go ahead and make the motion to approve to do that.
$20,000.
So I would make the motion that we approve the health department purchase of these software to do death certificates and birth certificates. The money is in the health department budget and will come from their funds. So I recommend that we approve that action.
And I'll second that.
All in favor, say aye. Aye. Opposed? Okay.
Yep, and then just as an FYI, I know that there has been a lot of conversation around emergency preparedness. I am working with Liddy to get information back to the key stakeholders, but that is due for renewal. I believe that is in the process of being approved and processed, if that's right, Laura. It's already been sent through and approved by the state. So I'm just bringing that to your attention, that the deliverables are unchanged. And I'm going to continue to work with key stakeholders to make sure that we educate and that we understand what the key objectives and deliverables are for that particular grant fund and how the county is benefiting from that.
Okay.
So that's all I got.
Good job, ma'am. Appreciate it. Appreciate your efforts. If we can do anything to help anytime, let us know.
Thank you.
I didn't mention that. I remember Paula Peters from the Highway Department. This is her daughter, so she has big shoes to follow. But you follow them pretty good so far, so you're doing all right.
Can I talk to you?
All right. Anything else you might have? Any business to bring up? I have failed. I have not ordered the camera that we approved for John to use, and I just realized that today with an email or a message from him. I just realized that that was not on my radar at all. That wasn't anything that I was doing, but I should have done that. So I have got the information from him now, so I will order that. I will purchase that on my credit card, and then when we get it in the invoice, I'll deliver that for reimbursement, then to come back and pay me back for that. Okay, the other department we have that's here would be you. Nice timing.
Okay, well, I've been here.
Get video road done today?
No,
Okay.
no.
Cleaned up limbs, aren't you?
Yeah,
Trees.
they just started about noon.
I figured that.
That was quite a storm with you this
Yeah, it
morning.
was. Yeah, it was a pretty good storm. Pretty widespread too.
Yeah, it was.
Didn't get much rain, but
I went down to Terre Haute. There were limbs and trees down all over on the way to Terre Haute.
Mhm.
Went in on the old 41, and it was a mess.
yeah. Got some covered bridges I'd like to get repainted.
Okay.
The Mansfield Bridge, the walls on it, cost us $6,500. Conley Ford Bridge, the roof, $3,500. And be a little bit of repairs on that too.
Okay.
Mecca Bridge, the walls, $3,700.
Now, you know, we're redoing the Mecca
You don't want to
Bridge.
do Mecca.
Oh, okay.
Yeah,
All new
pay
siding
back off
on
that,
it.
and that's being paid for half by you and half by the CVC, if you remember that conversation. Yep.
Okay.
So that'll be taken care of.
Okay, I better note that so I don't forget that.
Dan was confident that would be done by Bridge Festival time, so that'll be good.
Okay. Sim Smith Bridge, the walls, $1,850. Rex Creek Bridge, the walls, $1,850. Bowser Ford Bridge, the roof, $1,700 and $1,850 for the walls. So less the $3,700 for Mecca Bridge would be 20. So take 20 or that much off of 20,000, be 16, a little over 16,000 altogether.
Okay, that's just all your budget money? Coming out of your budget, then you've got
Oh,
that for
yeah.
that? Yeah, okay. Well, I think that's great. So I would make the motion that we approve the painting of the bridges as presented by the highway superintendent.
I'll second that.
All in favor, say aye. Okay?
Okay. And I don't know if I told you last time or not, but all our chip and sealing is done.
Think that painting will be completed by Bridge Festival time?
I imagine, yes.
Great.
Barney doing it?
Yeah, Barney.
Okay, great.
And Bloomingdale Road, we should have it done tomorrow at noon, I imagine.
Great.
When we go
You
to
had
Jessup Road, then,
you had some people concerned. I got a couple phone calls about VIDEO Road before it was done, about how shoddy it was, yada yada.
well, that's the first.
That's what I told them, typical stuff. I said, I can't believe they leave it there. So I drove, I said, well, it's obviously not finished yet, so let's wait till it's finished. I'll look, and it looks great. So you guys doing
Yeah, we
great.
don't care if it skins little places.
Right,
It's
right.
the first lay, just
Yeah.
get it leveled up.
And then one of the guys who carried on most, he said, I know nothing about asphalt. And it's like, yeah, you're right. I mean, at least he admitted he did, but he thought, but it wasn't done yet. So it
Yeah.
looks good. I've driven all of that, and it looks good.
We did have to close, I can't remember the bridge, I think it's 46 on Tick Ridge Road for the bridge inspector.
Okay?
Some of the piling is rotted off now next, well, up a ways really. So I don't know for sure if we're gonna take the beams off and pour concrete, or they've got a kind of a lake-like up there, the upper end of it. We may be able to downsize it to a big pipe, maybe, I don't know.
Oh, okay.
Get culvert guys to run drainage on it, see if we can. I don't even know which would be cheaper yet, I haven't had a
Yeah.
chance to figure it out That's about all I have.
Did you get a chance to go out and look? You probably didn't, you may not even know about it, where they were running through the culvert there on, what road is that?
350.
350.
During the races out at Leon Bryant, former Leon Bryant, they were driving through our culvert to get from one side of the creek to the other side. And Dan got them to stop that, and they changed their route. I can't imagine they did any damage, but we felt they could have probably if they.
I went back out there, and I think what they ended up doing was using it for the guys racing, going back and forth to their campus. But they originally had it flagged to race.
I got you.
It was on the course.
It was actually dropping over right beside the guardrail, the highway bridge on 36, dropped down it, went under it, up the creek, and then turned up back to the east on the small creek, going under 350, that new bridge you put in. And as soon as they got out of it, it was cutting up the hill right along the wing wall.
We were more concerned about the bank.
Yeah, it was, you could tell they run it pretty hard, even the one on the state bridge. But after I said something to him, he was in here and asked for permission to close the road. But he didn't say anything about closing everything else.
So anything you need, you're in good shape. You got the chip seal done. Okay.
Now I need more employees and more trucks. 3 or 4 of them's down.
Really?
Well, counting the one that we wrecked, you know.
Yeah.
You're only one employee down?
No, I think I'm 5 down.
Oh, boy.
And how many trucks? 4 trucks? Okay.
So we just do what we can.
Yeah.
Yep. I was going to ask you about, let me think what this was.
Oh, we did close 350 North today too.
Okay, I told you.
Green Township Road.
Yep.
Started to put that pipe in.
Okay.
Take the structure out and put the pipes in.
And has that been on the grant that was approved, or is it on the grant we submitted? When we
We
submitted?
didn't submit it because I just found out we could only ask for, less than 300,000.
That's where I thought we were, about 280 or so, yeah. Yeah, I didn't think it was a million each time, it was a million a year, I think is what it is, yeah.
So we'll just have to wait till next time
Okay.
on that one.
That'd be nice to get that done. Be nice.
We get the pipes in that way, then get settled down.
Oh, I know what I was gonna ask you. I got asked a while ago if we were still doing the chip seal where the residents pay for it and have it done. I said yes, but I don't know when those requests had to be in by.
Well, we're done now.
I told you you're done for this year, but it'd be next year. But when they have to let you know by to get on the list to do that? Should they just call you and find out what the cost would be and how long?
Yeah.
We're talking about Clay Plant Road there past where Belcher and Jeff Thompson live and on around to where Brett Cook lives, that road,
Okay.
opposite way of Annapolis Road there. So that's what they're interested in getting done. They talked about it before, but then it kind of fell apart or else. I'm not sure what the issue was, but he thinks maybe he can get them to do it now, if that's something that we still did. I told him, I was sure we did.
Yeah, we just don't match anything.
Right.
We just do the work.
Yeah, that's what I told him, yeah.
Kind of hard to even give a price.
It is now.
It is
Things
right
change
now.
so much,
Yeah.
so fast.
Well, you wouldn't be doing it until next year.
Yeah.
I wouldn't even know where to even begin with the price right
So we
now.
should just talk to you this spring
In
sometime?
the spring, yeah.
Okay. I'll tell them. Nothing need from us, other than more people and trucks and more
Well,
money?
that's about it.
Other than that, we're okay?
Yeah, other than that,
Trucks, money, and employees.
Yeah, not a problem. I'll ask Mr. Pratt to write you a check, whatever you need, you just tell us, and we'll
Okay.
give him a call.
All righty.
Okay, thanks, Randy,
Have a
appreciate
good
it.
evening. You guys have a good evening.
thanks, Randy.
Anybody else have anything? Hamilton Center have any requests or anything? I do appreciate you showing up, and if anything comes up that you need from us, or if we have questions of you that way, that's great. We did talk about, when the lady was here before,
Stacy.
yes, about maybe getting, and it doesn't have to be a report, just a discussion sometime. When people ask us what do we get for our money, we don't really know what the programs are, and we don't really know how you even judge success in those programs ever. I don't know how you do what you do, but I know you do it, and so sometimes I like to have the discussion in a meeting, just about the kind of programs you have going on, maybe the numbers of people in the county that are affected by your programs, and how you feel your success rate is. It's just, like I said, I don't know how you even make that judgment of a success or failure, but I don't know how you deal with those issues and those problems as you do. So Maybe sometime have it.
Yeah, we can do that. I'll talk with Mandy, the program manager. That's
Okay.
more clinical stuff, so.
Because we get asked sometimes,
Oh, yeah.
and we don't have an answer, you know, so it makes, I'm not worried about the image, but the image is that we're paying you money, but we don't know what we're buying, we don't know what we're getting out of it. So if we had a report sometime along those lines, we could answer for that, that'd help.
Absolutely.
That'd be great.
I'll talk with her and see when she can,
Okay.
but I'll let you know next time. Maybe
Okay.
get on the agenda.
News media, have any questions or anything of us? So we're good? No gizzards still, I guess?
No.
Man. All right,
Make a motion, we adjourn.
Second.
we're adjourned.